you are just joining us and if you have stayed with us, I'm going to say it again, this is our third annual Greener Care Conference. And I'm already full of inspiration and hope for the future now, just by listening to some of the amazing work that's going on. Now, Janet, you have the pleasure, you have the duty of closing us out on an absolute high. So please introduce yourself to our delegates and away you go.
Hi, I'm Janet Smith, Head of Sustainability for Royal Wolverhampton NHS Trust and Walsall Healthcare NHS Trust. I would ask actually, yes, she's quick to the draw. Yes, what I'm going to actually share with you today or this afternoon is how we green our confidential waste in the trust. So next. So the case for change. Why did we actually decide to green our confidential waste service? One is that it was actually the original system was we had an external contractor actually collecting them, which cost the trust about 140K a year. And also about 15K was spent on shredders. And there was about 79.5 tons of CO2 just to collect the waste from one site, or our New Cross site, and then going to Nottingham. They used to collect 4 times a week. So, and also we realized that actually staff spend quite a lot of time sitting there and shredding papers before they actually get into collected by the company. So we thought there must be a better way of doing this. So next slide, please. So what we did is that we actually pulled together, or our waste and recycling team has pulled together a business case to look at an in-house surveys managed by their team. So that was, we look at the trust supported the scheme, and now what the service does is it provides free confidential data destruction and office paper recycling for all sides of the trust rather than just New Cross Hospital. So it covers the community, the GP practices that we have, the 2 other hospitals that we have, and any other areas where our staff are actually based. So it also improves service effectiveness which means then that we are able to actually schedule them better, and people knows then when they're coming, and then so it's and also the other thing is that it actually allowed staff to just buy the bins, put it in there, and it's collected regularly. So there's no waiting for collection to come. And then it also reduced cost pressure for the trust. And the only thing that cost the departments was a one-off cost for confidential waste bin, which cost them either £60 for a smaller one or £120 for a bigger one. Next slide, please. So the outcomes and benefits. So one is it reduces data breaches, because what happened before was that, of course, when staff was shredding, and then they get pulled out somewhere, they leave the paper on the side of the shredder, and then with the intention of coming back. And sometimes things that are actually confidential is left there. So that's data breaches happens. So also it actually give the trust cost savings on replacement of broken shredders. The other thing is it saves staff time, and also it actually saves 35 tons of CO2 on logistics. And the trust actually does get a rebate per ton of paper that's recycled. And £100 as well per ton savings by preventing paper from going to domestic waste stream. And all in all, for 1 year, we actually realized about just over 30K annual savings compared to the previous system. So next shows you how the confidential waste system, recycling system is managed, and also it shows you the stuff in action. Thank you so much. So that was actually the just a short video showing what we do and what the you can see them in action, and the also our lorry that takes it. So there were challenges actually when we implemented it. The wrong type of waste does get put into the bin, into the waste recycling bin. So what our waste and recycling team sometimes has to do is when they open it, they actually fish out some of the wrong ones. So some people sometimes put catalogs in it, and some put like food wrappers, which is a bit naughty, but it does happen. So there were also issues about some of the departments reluctant to pay for the bin, but we have overcome that because they realized that actually it's a one-off, and the rest of the recycling doesn't actually, the cost of the recycling or the cost of the shredding disposal doesn't actually hit their budget. So it's a free after the 120 or 60 upfront cost. And then also there was an issue because communicating the value of the scheme sometimes, because of, it's about having that switch in perspective that actually this is something that is valuable to the trust. This is something that is different from what it was before. But we have overcome that, and now the scheme is actually working very well. So next one, please. Yes. Any questions? That's the end of my presentation.
I think that's fantastic, Janet, and I think it's a really innovative way to solve a problem that everyone has. And data breaches, data management is something incredibly key throughout the whole of health and social care. And again, I know I champion in social care here. In social care, we're way far behind. You know, I've actually spoken to people who used to put their data into the chicken coops and use it as bedding. And it's like, oh, there are better ways around it. There's no you're trying to recycle, but data breaches are huge and are key. And I think it's great that you shared some of the problems that you'd faced as well when implementing this, because I think it gives us food for thought if it's something that we want to implement and start ourselves. Has anyone got any questions? I know, Colette, you come up into the chat with a comment. Do you want to come through and speak about it, or would you want me to read it out? I'm just gonna. So Colette said that she used to work for an organisation that did similar, but after the local paper mill closed down nearby, the job was outsourced as it wasn't cost effective to transport it further outside the southwest. Staffing issues, sickness meant that there were regular problems with collecting the schedule. Having the solution outsourced meant the external company had to manage that element. How much cost and what hours are allocated to the staff to manage the solution?
We actually employ the two guys that you see on the video. They're actually employed full time. That's their only job, and the cost of the system basically, based on the if we have on the old contract, which costs us 140K annually, we actually spend at the moment about 110K. And that includes the salary of the two operatives, that includes the rent of the lorry, and that includes as well the fuel and all other expenses associated with the service, except for the bins, because the bins is paid for by each department. So that actually then is the cost. So about 110, and then we realize about 30K difference. And of course we do also get rebates from the paper, the recycling of the paper, and of course rebate from the domestic waste. So preventing these going to domestic waste, because we had last year, it was about, until December, it was about 79 tons of paper in all our sites. And then when you think about that actually also is equivalent to a lot of tons in terms of that's 2.24 tons as well of CO2 save on preventing it going into the domestic waste stream. So there's a lot of things that could happen. I think it works for us because we've worked out that if we actually, the cost, the 140 was only for one site, while this service actually services all our sites. So that means 3 hospitals and 54 community premises. So it's expanded more, and we also saving from it, not just on carbon, but also on money. And it's I think what it is that for those who wanted to actually implement a similar scheme is to look at what they currently have in place. What realistically is the the volume of the paper? Because one of the things that we did, where we don't only address the confidential waste, it includes paper, the paper that ordinary printing paper, things like that, and also we actually include the little pharmaceutical packets, the boxes. That's so the little ones is also included in it. So it's expanding, and actually we're looking at all of those that we can except for the the big boxes. So those little boxes, empty ones, we include as well on it. So it's about looking at what you have, looking at what you realistically use in terms of paper, not just confidential, but office paper, and also what other things you can put in it, and then work it out, because there is value in it, whether it's a smaller scale or a bigger scale, and the van that you use, you can actually even maybe within your PCN, maybe that's something that the PCN can actually invest together.
So for anyone here today or who's going to watch this on catch up, how does one look at implementing something similar in their trust? Is there like a blueprint that you've created at Royal Wolverhampton, or is it something that you could look to create like a blueprint that would be able to go out across other trusts?
Yes, definitely. And it's the same as well with our walking aids recycling scheme. We're actually putting together a kind of just a crib sheet on how we implemented it. And same way with this. And moving forward, we're actually implementing now an inhaler recycling scheme, which we will also be sharing with everyone, because it's one of those, I think it's a recycling scheme that already uses existing systems, so it doesn't cost an arm and a leg.
That's absolutely brilliant, and I think it's really great to see localized initiatives within the NHS coming up with these ideas. I think it's fantastic to see, and hopefully things can be replicated across the country. And I always say, innovation's great. Let's not reinvent the wheel. You've given us the wheel here. Yes, a bike wheel might not fit a car, but we can make it fit. We can change it and we can adapt it to fit our services, as long as the sort of principles are the same. I think it's a really, really good solution, Janet. Has anyone got any other questions before we start to close down for the day for Janet? Janet, have you got anything that you'd like to leave us with?
Yeah, I just wanted to add that I actually run a share and learn forum for sustainability. And that's every quarter. And we might actually increase it to bi-monthly. But it is actually a share and learn forum to learn about sustainability, about initiatives. The previous session was about mitigation and adaptation, climate change impact mitigation and adaptation planning. The second one is actually greening clinical services, experiences from the shop floor. So that's the title. And if anyone is interested in joining it, I will send to Jade the details, and then everyone's welcome.
That's brilliant. Thank you so much, Janet. We'll make sure that we get your slides and the information sent out to everyone who's attended today, and any of our members who might want to join as well and want to get involved. So thank you so much for your time. I'm just going to make sure there's no more questions left in the chat. Jade, am I okay seeing us out now? Fantastic. Well, this has been, and I say it again, our third annual Greener Care Conference. I'm already looking forward to our fourth one next year, but I think within the 12 months from this conference to the next, I know I speak for everybody here, we want to see some massive changes moving forwards. I want to see more solutions like the ones presented by Trimedica. Grace Cares, we want in hubs all around the country. We want no contact stuff. We want more innovative solutions such as Janet's spoken about and everyone else who's spoken today. We want to see as much as we can do making progression within the health and social care sector. We're here to care for people, and people include everybody in society, include ourselves and the future generations. So thank you everyone for joining us today. Our next special interest group on greener care is on the 26th of May. That's going to be at noon, so 12 till 1. Jade has popped the registration link down into the chat for everyone to sign up and register to. And that will be chaired by Dr. Elaine Mead. Again, huge thank you for Elaine for providing us with the keynote today. But enjoy the rest of your afternoons. Thank you, everybody, for joining us. This will be available on Catch Up. I think, Jade, I'm not speaking out of turn. It will be available on Catch Up. We'll get you out the slides of everybody who's presented here today. A huge thank you to everyone who has joined us today to present. Time is precious, and we really, really are grateful for that. And thank you for everyone for joining us to help further your knowledge around greener sustainability in care and really making the future of health and social care greener. So enjoy the rest of your afternoons. Have a fabulous rest of your week. And we will see you at the next Greener Care SIG on the 26th of May. Take care, everyone.